Is your little one feeling warmer than usual? It might be time to take their temperature. I'll show you different ways that you can do that. A normal body temperature for infants is between 96.8 and 100.3 degrees Fahrenheit. No matter which type of thermometer you're using, you always want to start with a clean tip. You can use rubbing alcohol or soap and water. And after you're done, give it a quick clean too. There are 3 basic types of thermometers: multi-use, ear thermometer, or forehead. A multi-use thermometer can be used either under the arm, rectally, or orally. For measuring the temperature under the arm, first turn on the thermometer, stick the tip directly in the armpit, gently hold the arm down, and wait for the beep. Make sure that you're touching skin and not clothing. That will interfere with the accuracy. If you're unsure if the temperature is accurate, just check again, but on the opposite side. Forehead thermometers can be a gentle way to check your baby's temperature. Simply turn it on, scan across the baby's forehead, and read the reading. Always follow the directions that come with your thermometer. Once your baby is 6 months or older, you can use an ear thermometer. You want to make sure that it's placed correctly, so gently pull the baby's ear out and then away from the body, and then direct the scanner in and press your button. Your pediatrician may direct you to check a rectal temperature on the baby if they're concerned about accuracy. Start by applying a small amount of petroleum jelly to the tip. This will help it to glide in gently. Turn your thermometer on. Your baby can be on their back or on their stomach, whichever is more comfortable for them. You place the rectal thermometer in no more than 1/2 inch. The silver tip is just about 1/2 inch. Wait for the beep, and then you'll have your reading. If there's anything that seems different with your baby, they're sleepier than normal, they're fussier than normal, they're not eating like they used to, or anything that just seems off, call your pediatrician. You know your baby best.